So are you? Hello.
Assalamu alaikum, sir.
Are you okay?
জি স্যার, ভালো। আপনি ভালো আছেন?
I'm okay. So today we will discuss the card number 23. Card number 23. I think it is board 2. And our first question of today card is, what are the causes of CLD? The virus causing CLD are hepatitis B and C virus, and some genetic disease like Wilson's disease, hemochromatosis, alpha-1 antitrypsin deficiency. Among the veno-occlusive disease, Budd-Chiari syndrome. Budd-Chiari syndrome. Budd-Chiari syndrome actually portal vein thrombosis. Portal vein thrombosis. And the toxin or alcohol. Another disease, that is non-alcoholic fatty liver disease, also causes your cirrhosis of liver. Primary biliary cirrhosis, PBC, can also causes cirrhosis of liver. So these are the causes of CLD or cirrhosis of liver. What are the paraneoplastic features of bronchogenic carcinoma? The endocrine features of bronchogenic carcinoma paraneoplastic feature is ectopic ascites syndrome, Chiari syndrome of inappropriate ADH secretion, hypercalcemia, and gynecomastia, carcinoid syndrome. So these are the endocrine features of paraneoplastic features. Musculoskeletal features, Eaton-Lambert syndrome. I have told previously that Eaton-Lambert syndrome and myasthenia gravis, both are your musculoskeletal disorder, but myasthenia gravis is an autoimmune disease, but Eaton-Lambert syndrome is a variety of myopathy where there will be detrimental change during electromyogram, but incremental change occurs in Eaton-Lambert syndrome. Incremental change means during repetitive contraction or stimulation of the muscle, the amplitude of the muscle potential will be gradually increased. It is Eaton-Lambert syndrome. But in myasthenia gravis, repeated stimulation causes decreased amplitude of the muscle fiber amplitude. Regarding the nervous feature, peripheral neuropathy, myelopathy, and renal feature, nephrotic syndrome, and others are hypertrophic pulmonary osteoarthropathy. Hypertrophic pulmonary osteoarthropathy, it is a bony change, usually occurs in the distal end of the radius and ulna, and it becomes very much tender, and it is associated with clubbing, and it occurs in bronchogenic carcinoma. Our next question is, what is Pancoast syndrome? Pancoast syndrome is characterized by apical lung tumor. And second criteria is lesion in the brachial plexus, especially C1 and T8, and pain in the shoulder joint and inner aspect of the arm occurs. C1 and T8 involvement causes pain in the shoulder and inner aspect of the arm, and there will be wasting of the short muscle of the hand also. So these are the features of Pancoast tumor. So Pancoast syndrome is a apical tumor of the lung causing pain in the inner aspect of the arm and wasting of the short muscle of the hand due to involvement of the brachial plexus, lower end of the brachial plexus. How will you treat hyperkalemia? This question comes repeatedly, and it is, it is treated by calcium gluconate and 25% glucose 100 ml with lactapid insulin, soluble insulin 5 minutes, and injection Lasix or orally Resonium, spelling mistake. And another is your injection on 7.5% sodium bicarbonate, and lastly dialysis. So these are the different measures that taken for treatment of hyperkalemia. Our next presentation is your, what are the presentation of pyelonephritis? Pyelonephritis presentation is a third presentation. Three presentation. One is low pain, radiates to joint, fever with chill and rigor, and tenderness over the kidney or renal angle will be tender. Our next question is, what are the features of multiple myeloma? The common age of multiple myeloma patient are 60 to 70 years, and severe back pain due to osteoporosis or bony fracture can occur. Blurring of vision, tinnitus, this may occur due to hyperviscosity of blood, which occurs in multiple myeloma. And anorexia, nausea, vomiting can occur due to CKD or chronic kidney disease. Polydipsia can occur due to your hypercalcemia, and sign is anemia, heart failure, bony tenderness due to osteoporosis, and proteinuria due to nephrotic syndrome. What are the presentation of tetany? In adult, tetany is presented with tingling sensation in hands and around the mouth. Carpopodal spasm may also occur. Subclinical tetany can occur, which can be detected by Traugius sign and Hostek sign. But in case of children, convulsion, stridor, and carpopodal spasm, this strid is present. And carpopodal spasm is very common in children. So this strid of feature is common in children. How will you treat tetany? Tetany is first treated by calcium gluconate 10 ml IV slowly over 20 minutes. And sometimes continuous drip of normal saline with calcium gluconate can be given at the rate of 10 milligram per hour. It is given over several hours till patient is symptom free. But sometimes it is associated with hypomagnesemia. At that time, magnesium, 50 millimole magnesium chloride is given IV over 24 hours. And treatment of the underlying cause should be done. What are the symptoms of anxiety neurosis? The common symptoms of anxiety neurosis are insomnia, palpitation, tremor, sweating, irritability, breathlessness, and fear of impending disaster, headache, frequent urination. So these are the different features of anxiety neurosis. Now we have come to card number 24. And here the first question is very easy question. What are the common causes of ascites? The common causes of ascites are CLD, abdominal tuberculosis, abdominal malignancy spelling mistake, and congestive cardiac failure. Our next question is, what are the common causes of hemoptysis? The common causes of hemoptysis are are your bronchiectasis, chronic bronchitis, bronchogenic carcinoma, pulmonary tuberculosis, and lung abscess. And cardiac cause mitral stenosis, LVF, and blood disorder, hemophilia, and leukemia. What are the causes of type 1 respiratory failure? You know, type 1 respiratory failure means when the oxygen concentration of blood is less than 60 millimeter of mercury, but the carbon dioxide level is normal. It is called type 1 respiratory failure, and it is caused by pneumonia, bronchial asthma, LPF, pneumothorax, and ARDS. Our next question is how to treat hyponatremia. Treatment of hyponatremia depends on severity of hyponatremia as well as how rapidly hyponatremia develops. So during treatment of hyponatremia, we should consider whether the hyponatremia develops slowly or rapidly. Rapidly means over hours and days, and slowly means over weeks and months. This is number one. Number two, whether the hyponatremia is severe or mild moderate. Mild means 120 to 135, moderate means 110 to 120, and less than 110 is severe. So considering these two things, you should give either 0.9% sodium chloride solution or 3% sodium chloride solution. But so indication of 0.9% sodium chloride solution is mild to moderate hyponatremia, and hyponatremia develops slowly, that is over weeks and months. But indication of 3% sodium chloride, severe hyponatremia and hyponatremia with hypervolemia, and hyponatremia develops rapidly over hours to days. But before starting treatment, we have to find out or calculate the required sodium level for that patient, and that is calculated by a formula, that is normal sodium value minus patient sodium value into weight in kg into 0.6. So accordingly we can give 500 cc or 1 liter or 2 liter or 0.9% sodium chloride or 3% sodium chloride. That is determined by the amount of sodium required. Our next question is, how will treat reversible factors or features of CRF? Reversible features of CRF are hypotension, salt and water retention, urinary tract infection, and urinary tract obstruction, and nephrotoxic drug. These are the 5 factors, reversible factors of CRF. One is hypotension, second is salt and water retention, third is urinary tract infection, fourth is your urinary tract obstruction, and fifth is nephrotoxic drug. So hypotension can occur due to misuse or over treatment by antihypertensive drugs or diuretics. So we must be cautious regarding this pressure. Salt and water should be controlled by restricting salt and water intake. And urinary tract infection can be treated by doing urine culture and treatment by culture sensitivity report. And urinary obstruction can be relieved by removal of your renal stone and avoiding sub-nephrotoxic drugs. As for example, ACE inhibitor is a nephrotoxic drug. Antihypertensive drug is nephrotoxic. It should not be given in very high level of the serum creatinine level. And even ceftriaxone, which is commonly used antibiotics, NSAIDs, commonly used drugs. These are nephrotoxic. So we must avoid this nephrotoxic drug. Then we can treat CKD. Our next question is, how will you treat non-Hodgkin's lymphoma? So non-Hodgkin's lymphoma is treated by CHOP therapy, and each cycle given 3 weeks interval, 6 to 8 cycles. And each cycle consists of injection cyclophosphamide, injection oncomycin or vincristine, injection hydroxyadriamycin, and prednisolone. Our radiotherapy is given in stage 1 disease. Our next question is, what are the presentation of acromegaly? The facial presentation is prognathism, that is protrusion of the lower jaw, enlarged nose, and thick lip. These are the facial change. In hands, there will be large hand and carpal tunnel syndrome. Carpal tunnel syndrome means compression of the median nerve and causing your wasting of the thenar muscle and tingling and numbness sensation in the hands and dewy feeling of the palm of the hand. So these are, and another one is your frequent change of gloves and ring in the hands. It is a present feature of acromegaly. In foot, large foot, increased heel pad thickness, and frequent change of shoes. Skin becomes thick and greasy. BP, hypertension can occur. And sign of active disease or acute disease is headache, blurring of vision, and increased sweating. How to diagnose diabetes mellitus? Patient having symptom of hyperglycemia, that is polyuria, polydipsia, and polyphagia, with fasting blood sugar 7 or more than 7 millimole, and 2 hours after breakfast or random blood sugar 11.1 millimole or more than 11.1 millimole. Then diagnosis of diabetes mellitus will occur. What are the symptoms of depressive illness? Depressive illness is characterized by depressed mood most of the time of the day, loss of interest in work, insomnia, weight gain, suicidal tendency, slowness of activity, reduced self-esteem. So these are the features of depressive illness. Our next card is card number 25, and this is the last card. And the first card question is, what are the important causes of hypothyroidism? First cause is Hashimoto's thyroiditis. It is autoimmune disease. It only occurs in females, and it is goitrous hypothyroidism. And next one is atrophic hypothyroidism, autoimmune cause. And next one is radioactive iodine ablation therapy. And some drugs causing hypothyroidism like carbimazole, spelling mistake, methimazole, propylthiouracil, lithium, amiodarone. Amiodarone is antiarrhythmic drug. Lithium is an anti-manic drug. Propylthiouracil it is antithyroid drugs. Carbimazole, spelling mistake, methimazole, these two are also antithyroid drugs. Thyroidectomy. Total thyroidectomy can cause hypothyroidism. Subacute thyroiditis can cause hypothyroidism, iodine deficiency. What is Graves' disease? It is a variety of hyperthyroidism characterized by ectophthalmos, diffuse goiter with or without bruit, and pretibial maxillary. So it is a variety of hyperthyroidism. It is the commonest cause of hyperthyroidism or thyrotoxicosis, which is characterized by diffuse goiter with or without thyroid bruit, then ectophthalmos, then pretibial maxillary. So these are the triad feature. What is microalbuminuria? It means daily loss of albumin 30 to 300 milligram through urine. And the commonest cause is diabetes mellitus, and other factors are hypertension and smoking. How to treat microalbuminuria? Microalbuminuria can be treated by SC inhibitor and ARB, and good control of diabetes and good control of hypertension by SC inhibitor. Give the line of treatment of ALL. General measures and specific measures. In general measures, blood transfusion should be given to control hemoglobin level and platelet level. Number 1. Number 2, IV broad spectrum antibiotics to prevent infection. And third, selection of the patient for his specific therapy. Because patient above 65 years should not be given a specific therapy, because this therapy is very much hazardous. And a specific therapy is given in three forms, 3 stages. Stage 1 is your remission induction, and it is treated by injection vincristine, injection doxorubicin, and intrathecal methotrexate. Intrathecal methotrexate means injection methotrexate given through the subarachnoid space. Subarachnoid space, like spinal anesthesia, and prednisolone. These 4 drugs are given in remission induction. And secondly given in remission consolidation phase. In this phase, injection doxorubicin, injection cytarabine, and injection MTX. These 3 drugs are given in consolidation phase. And remission maintenance, and it is given by injection vincristine and oral MTX and prednisolone. And newer treatment is your homologous stem cell transplantation, bone marrow transplantation. It is the newer treatment that is very much effective. Now, what is nephrotic syndrome? Nephrotic syndrome is characterized by anosarca, massive proteinuria, that is more than 3 grams per day, hypoalbuminemia, and hypercholesteremia. How to treat nephrotic syndrome? General measures: restriction of salt and water, and no extra dietary salt should be taken, and water intake should not exceed 1 liter per day for adult, and normal intake of dairy protein 1.5 milligram per kg per day. And diuretics furosemide should be given, corticosteroid tablet prednisolone 1 milligram per kg per day 6 weeks, then on alternative for another 6 weeks. In case of relapse or incomplete remission, then maintenance treatment is given. Maintenance treatment is given by low dose prednisolone plus your cyclophosphamide or cyclophosphamide. Now, what are the causes of hyponatremia? Hypovolemic hyponatremia is caused by diarrhea, vomiting, and furosemide. Euvolemic hyponatremia is caused by shared syndrome of inappropriate ADH secretion and hypothyroidism. And hypervolemic hyponatremia is caused by cirrhosis of liver, CCF, and nephrotic syndrome. How to treat esophageal varices with portal hypertension? First, resuscitate the patient by giving normal saline infusion and blood transfusion. Secondly, reduce variceal bleeding by injection terlipressin. And emergency endoscopy should be done, and band ligation should be done. And prophylactic therapy for portal hypertension, there is propranolol 40 to 80 milligram daily. And PPI to prevent PUD, and lactulose to prevent hepatic encephalopathy, and prophylactic antibiotics to prevent or spontaneous bacterial peritonitis. Our next question is, what is bronchiectasis? It is a chronic necrotizing inflammation of the small airways, usually bronchi, characterized by purulent productive cough with copious sputum. So it is a chronic, not acute, necrotizing, that means necrosis and inflammation of the small airways, usually bronchi, not bronchioles. Bronchi is affected and producing the purulent productive cough with copious sputum. Copious sputum means when daily sputum amount is 1 teacup. Give the outline of treatment of bronchiectasis. Specific treatment: send the sputum, spelling mistake, for culture sensitivity and start our treatment with empirical antibiotics. We can give ciprofloxacin, we can give ceftazidime, injectable form when the patient cannot take orally or patient suffers from severe or disease, and coamoxiclav, it is oral, it is given oral form. Azithromycin also given oral form, and changes of the antibiotics after 72 hours according to culture report, and duration of treatment 4 to 6 weeks. General measures: postural drainage. Surgical treatment is given when medical treatment fails and when single lobe is affected, and type of surgery is lobectomy or pneumatictomy. Our last question is, what are the anxiety disorder? Anxiety disorder is anxiety neurosis. Second is phobic anxiety disorder. Another is panic disorder. So this is the end of today's class. Thank you.